Welcome everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, presenting another edition of Insights. Today we have as our guest Kim Goslinga. Kim has recently joined OCAHS as a psychiatric mental health nurse practitioner, providing psychiatric care and management to our patients in Orange City Hospitals, Mill Creek, and whatever other location, right? But those are our locations. Part of our behavioral health team, along with Dr. DJ Donlin. So Kim, first of all, welcome to Orange City.
Thank you.
We appreciate the fact that you're here. What is your daily life like? What kind of care does a psychiatric nurse practitioner provide?
Right, so I focus on patients with mental health conditions, and primarily I am working with patients with their medications, finding medication regimens that work well for them and help manage their symptoms so that they can improve their day-to-day functioning that previously was maybe difficult for them because of their mental health. And so I am getting referrals from primary care doctors here in the clinic, and also people can self-refer, don't necessarily need a referral to come see me.
You talk a lot about mental health, behavioral health. What role does that play in an overall person's health and wellness?
Well, it plays a large part because mental health and physical health are very much connected. And so I think we will see when someone's struggling with mental health, you can see physical symptoms that they are also struggling with. For example, in children, you might see behavioral changes, sleep problems, changes in the way they're eating, and the same is true for adults. They might struggle with physical symptoms like problems with sleep, appetite low, not feeling like themselves, low energy, low motivation, that kind of thing.
So you talked a little bit about some of the differences between you and Dr. Donlin. Can you elaborate on that a little bit?
Right.
So I know, for one thing, as an example, you do medication. You can prescribe medication and do medication management. He probably does not do that, correct? So are there other differences?
We both diagnose and assess for mental health conditions. And so the way we treat patients for those conditions is different. He will be focusing on doing therapy, whereas I primarily focus on the medications, yeah.
Good. Can you, obviously you're not here on an island, and you're actually physically integrated with our family practice team. Can you talk a little bit about that integration? Do you like it? Does it work?
Right.
Benefits?
Yeah, I very much enjoyed being in person here in the clinic, working directly with patients, but also primary care providers. I think it's a huge benefit for the patients and our team as a whole to be able to go down the hall quick and ask someone a question if we have a mutual patient, and vice versa. And I do think that mental health previously has been very siloed, where psychiatrists or psych nurse practitioners were working in a different setting or primarily mental health setting, and this being able to integrate is very important to viewing the person and caring for the person as a whole.
And maybe to add to that just a little bit, because it tends to maybe get lost in all this stuff to people, but that's the role of our clinical pharmacists. Sometimes people have direct interaction with our clinical pharmacists, and sometimes they may not, because maybe our doctors consult with the clinical pharmacist. So the clinical pharmacist here has a role in assisting you in the management of medication, right?
Right.
So that's another part of our team.
Right.
Going back to some of the challenges that you see in terms of mental health, can you address, or do you have any warning signs that somebody might look for or be concerned about in order to seek professional help?
Yeah, so I think big warning signs, of course, would include someone who's experiencing suicidal thoughts or having thoughts of wanting to self-harm. Again, if there's major changes in their mood or behavior, not sleeping well, not eating like they normally do, those would all be important warning signs to watch for. And especially in kids, behavioral changes, big outbursts that isn't typical for a child would be something to keep an eye out for.
Great, thanks. What's the best way to get a hold of you? Get plugged in with the clinic?
You can just call the clinic directly at 737-2000.
737-2000. Don't need a referral.
Don't need a referral.
But you can have a referral.
Right.
And I think that's one of the things that I think we have I don't know if this is an official term or not, but we have warm handoffs occasionally. And so I think that's part of the integration that we have and the benefit that if there's somebody that really would benefit from an interaction with you or Dr. Donlin that's in our primary care clinic, we have that warm handoff. We have that capability of being able to accomplish that.
Right.
All right. Anything else?
I don't think so.
You know where the cafeteria is and all that kind of stuff.
That's great.
Great. Priorities, right?
Right.
Yeah. All right. Thank you for joining us today. We appreciate that, and again for being part of our team. Thank you for this edition of Insights.